Generalized anxiety disorder. So a couple things I want to mention. I didn't mention in the previous video is that anxiety disorders are more common in girls than they are in boys. And they're more common before the age of 20. Okay? And anxiety is pathological when it's out of proportion to the situation. For example, maybe I see a plane crash on a movie that I was watching, and now I'm super scared of getting on airplanes. Okay, so it's a little bit out of proportion to the situation, and it interferes with social or occupational functioning. So, and now that I'm so scared, even though my job requires that I fly to New York every weekend, I can't. So now it's interfering with my occupational functioning. Okay, so now you know. Generalized anxiety disorder, it's chronic, occurs more than 6 months. So you know that anything occurring more than 3 months is chronic. So in generalized anxiety disorder, it has occurred more than 6 months, more days than not. It's unrealistic. There's nothing that's realistic that is actually causing the source of anxiety. There's no organic factors, so it's not due to like drinking too much coffee or hyperthyroidism. Okay, so not like you took a drug and now you feel this generalized anxiety, or you have a medical condition and now you feel this. Okay, most of these patients have signs and symptoms of depression, and stress makes it worse. Okay, and often these patients are your worry warts, and they'll have those somatic symptoms that really don't have an organic origin. Okay, your stomach aches and your dizziness and your headaches. Okay, now signs and symptoms. How I remember this is when I take an exam and then I go home and I check my grade and it's not good. So what do I feel? I feel excessive anxiety, right? I'm worrying about everything at this point. I feel restless. I'm on edge. I can't concentrate. I can't even listen to anybody talking because I'm just not happy with my grade, and I'm very anxious. And I'm easily fatigued. I just feel exhausted. I don't feel a source of energy. I just feel tired. Okay, and I can't sleep that night. If I have a bad grade that night, I'm not going to be sleeping well, that's for sure. And I'll be real tense, right? A lot of muscle tension. So maybe that'll help you remember. Just think about taking a test and you got a really bad grade. And you know what I'm saying. I hope you do. Well, I hope you don't, but if you do, now you know. Okay, so nursing interventions. You're going to stay with the client and assure their safety. Okay, they're going to be anxious. You're going to make them feel safe. Show them that you're there for them, and don't leave them by themselves just in case it turns into a panic attack. Okay, stay calm, right? Because anxiety is contagious. You've been around people who are anxious, and it's annoying. And then all of a sudden now you feel anxious. Okay, use simple words, no long sentences, no really complex words, because right now they are just focused on what's going on with them. They can't. Their vocabulary is going to be very limited, okay? And then if they hyperventilate, you can give them that bag, right? So they could breathe back in some of that CO2, and but not if the patient has pulmonary problems or some sort of cardiac health problems, then you don't want to give them the bag, okay? So reduce stimuli. You want to keep the room nice and the light low, and not too many things, because stimulation is just going to increase that anxiety. Administer drugs as prescribed by the doctor, and after the patient calms down a little bit, you can explore reasons for what led up to the event, and maybe you could teach the patient some relaxation techniques to calm them down when they are feeling that increase in anxiety. Okay, so Buspar is the drug of choice for generalized anxiety disorder because it works pretty well for like 60 to 80% of patients. It works. Okay, it doesn't cause dependence. It doesn't cause a CNS depression, and patients don't really build up a tolerance to it. And the only drawback is that it takes 10 to 14 days to kick in, so you need to tell your patient that, because otherwise they might think that the drug doesn't work. So Buspar is the drug of choice, okay, for generalized anxiety disorder. SSRIs are also given, and because they have less side effects, SSRIs are commonly given for anxiety disorders as well. Patients can get anxiolytics, the benzodiazepines, but those can cause dependence, and it's dangerous when the patient's withdrawing off of them, so they need to titrate off if they're going to be on the benzos. And antihypertensives such as propranolol or clonidine can also be given to reduce some of those symptoms, especially the physical ones, like we said earlier, the palpitations and all that. Okay. And that's it. Oh yeah, sorry. There's a couple of theories believe different things. Okay, so Freud thinks that it's underdeveloped ego, and so due to an unsatisfactory childhood or like parent relationship, the ego is underdeveloped, and the ego can't intervene basically between the conflicts of the superego and the id, right? The pleasure seeker, right, the id, and then the moral guy, which is the superego, okay? So overuse of the ineffective ego defense mechanisms leads to maladaptive responses to anxiety, okay? So basically Freud believes that it's an underdeveloped ego and he's just not good at mediating the problems between the id and the superego. The cognitive theorists believe that it's distorted and counterproductive thinking that results in irrational appraisal of certain situations. Okay, so it's basically faulty thinking that leads up to this type of anxiety disorder. Okay, and biological aspects of it, people believe it could be genetic. There might be a gene that manufactures the protein CCK, which is known to actually induce attacks when injected. Okay, or it's a neuroanatomical problem in the lower brain, the limbic, thalamus, and hypothalamus, and then reticular formation. Okay, and we already talked about the neurotransmitters, increased norepi, decreased GABA, and decreased serotonin, right, in the anxiety video, and medical conditions such as tumors and abnormalities in the adrenal glands or the pituitary or thyroid area can cause types of generalized anxiety disorder as well, according to the biological aspects of it. Okay, I hope this helps.